Welcome to our channel. If you need mental health services covered by insurance, follow these step-by-step instructions to access the care you need. Step 1. Review your insurance policy documents or call your insurance company to understand your mental health benefits. Ask about coverage limits, copays, and whether pre-authorization is required. Step 2. Verify that mental health services are covered under the Mental Health Parity Act. This federal law requires most insurance plans to cover mental health similarly to physical health. Step 3. Obtain a list of in-network mental health providers from your insurance company's website or customer service line. Using in-network providers ensures maximum coverage and lowest out-of-pocket costs. Step 4. Get a referral from your primary care physician if your insurance requires it. Some plans need this authorization before covering mental health appointments. Step 5. Contact potential therapists or psychiatrists to confirm they accept your insurance and are accepting new patients. Verify coverage details before scheduling your first appointment. Step 6. Understand your financial responsibility, including copays, deductibles, and coinsurance. Ask the provider's office about costs before your appointment to avoid surprises. Step 7. Keep documentation of all appointments and payments. Save receipts and explanation of benefit statements for your records and potential reimbursement claims. Step 8. If you're denied coverage, file an appeal with your insurance company. You have the right to challenge coverage denials, and many are overturned upon review. Don't forget to like this video and subscribe to our channel.